Hi friends, today we are going to discuss about classroom intervention for children with special needs. Now what are these special needs students? These are the ones who have various kind of disorders or problems and they need special intervention or special attention in the classroom so that they are able to achieve their optimum performance. So that is the purpose of learning, getting to know more about these special needs students. In this particular segment, we are going to talk about attachment and reactive attachment disorders. In short, they are known as attachment disorders or just AD. Now, attachment is the deep connection established between a child and caregiver, parent, or could be anyone, that profoundly affects your child's development and ability to express emotions and develop relationships. If you are the parent or teacher of a child with an AD, attachment disorder, you may be exhausted from trying to connect with your child. He is not autistic, so there is slight difference between autism and attachment disorder. So getting to know more about this disorder, attachment disorder, you will be able to understand what should be done or should not be done with such children. Now attachment is a reciprocal process by which an emotional connection develops between an infant and his or her primary caretaker. Here in the case we have parents or close relatives, maybe grandparents. It influences the child's complete physical, cognitive, psychosocial, emotional development. And to the extent that we develop properly during this stage, it becomes the basis for development of basic trust or mistrust and shapes how the child will relate to the world, learn and form relationships throughout life. But during this time, in case the child develops AD, attachment disorder, his personality patterns and other behavior patterns will require help and support from the caregivers. Caregivers again means parents, teachers in school and other peers, other people, significant others around them also play a very important role in shaping their personality. Now healthy attachment occurs when there is consistency in these emotional essentials which are very important, such as touch, movement, eye contact, smile. Apart from taking care of the basic necessities which is food, shelter and clothing. But if the process is disrupted, the child will not be able to be secure in his environment, maybe socially, emotionally or physically, and then various issues, personality problems can happen. And some of the factors which may impair healthy attachment at younger stages is multiple caretakers, where there is no one to take care of them at home. Father is working, mother is working, it's a nuclear family. These days, these things are happening more often, and that is why this kind of disorder is seen more often. So some of these factors are having multiple caretakers, invasive or painful medical procedures during infancy or childhood, more of hospitalization, various kinds of abuse, poor prenatal care, prenatal alcohol or drug exposure and neurological problems. So when these factors they become primary, then the child gets predisposed to develop attachment disorder. Then what happens when we say the child becomes predisposed to attachment disorder? Now children with attachment disturbance often project an image of self-sufficiency and charm, while masking inner feelings of insecurity and self-hate. The child is lonely from inside, but on the outside he is acting out as if he is a very social person, he is a very happy-go-lucky person, he is very charming, he is very fun-loving, but inside he may be very, very hurt. And that is where the problem starts to develop and starts to grow. Now these children, they have difficulty giving and receiving affection on their parents' terms. That when the parents want, they will. When the parents don't, they are not comfortable, they are busy, they are doing something else, then they will not give attention. So when attention during younger stages is unpredictable, the children tend to become overly demanding and clingy, with the result that they suffer parental rejection once again. They are trying to seek attention in negative ways. So remember, learners, in classroom also, if there is a student you realize, you feel that he is attention seeking, so try to see why is he behaving like that, because it is very important. And in education, we try to go beyond the why of behavior. Now additional behaviors of a child who is going through this attention disorder, he may be having poor eye contact, abnormal eating patterns, poor impulse control, poor conscious development, chronic crazy, lying, stealing. He is destructive to self and to others. And if he gets angry, he will just cut his wrist or he will hurt himself. He indulges in self-injury. And sometimes cruelty to animals also, and he is preoccupied with fire and blood, which one needs to be careful about, that if these symptoms are there, the child needs help. And during the primary stages and ages, the child is showing such things, and the teacher needs to identify such behaviors at the earliest. Because if such behaviors are identified early, the prognosis of the disorder also improves. So the role of the teacher assumes significance apart from parental responsibility. Now a child with insecure attachment or with an AD, attachment disorder, he lacks the skills for building meaningful relationships. And the same behavior gets reflected during primary years, middle years, secondary years, and even goes into adulthood, since it is a disorder and which has not been controlled in any way. Now the question is that maybe many of the children, they are going through probably the same pattern of parental conflicts, parental resentment, parental lives. Then why is it that some children develop attachment disorder while others don't? Now this is very important and relevant question, and the answer lies in the attachment process, and it also depends upon the interaction of parents with the child and the resilience of the child overall. Because probably if the child is resilient and there are other support systems, so even though parents are busy and caretakers are not doing their job properly, still the child is able to come through this particular phase in more or less is able to come out of this phase in a comfortable manner, and which does not affect his personality much. But if the child has been able to develop this disorder during childhood, then it is the result of negative experiences in early relationships with parents. Parents who are the primary caretakers or primary caregivers. If young children feel repeatedly abandoned, they may feel it. It's not that the parents have abandoned them, or they feel isolated or powerless or uncared for whatever reason. They will learn not to trust others, and it's a very, very important thing in their personality, not to be able to trust the other person and not being accepting the world as it is. And they feel that world is a dangerous and frightening place not worth living. So sometimes they indulge in self-harm or they indulge in daydreaming, which when increases in frequency, it leads to some other disorders also, other than attachment disorder, which has been there in the first place. Now, what are the problems which occur? We have discussed, we have been talking about these issues, that yes, that various kind of problems will happen. Especially when it occurs in the first 2 years of life, for whatever reason, when there is sudden or traumatic separation from the primary caretaker through death, illness, hospitalization of mother or father, or removal of the child from the main family for whatever reason. Or it could be physical, emotional or sexual abuse even at such a small stage, or neglect of his physical and emotional needs. It's painful, it's unfortunate, but it happens. It's a reality in many places, in many homes to even today. Or he develops some illness or pain and the caretaker is not able to understand the issues well in time. So the problem is not understood or rectified initially. So that also is traumatic experience for the child. Then there are frequent moves or placements. The father is in such a place, in such a position that he needs to shift his office, shift his residence every second 2 years or every third year or maybe every 6 months. So there are frequent moves and the child is not able to accept, and because of the moves and the stresses related to the moves, even parents have their own discord among them, between them, which may result in inconsistent or inadequate care at home. Maybe the mother is going through chronic depression, or there is some neurological problem in the child which develops in early infancy and which may again hamper his development of a good personality. Now when the baby cries and no one responds or offers comfort, now such a baby is not going to become a pleasing personality when he grows up. And when he is hungry or he is wet and no one has been looking after his needs for hours at a stretch, the mother has kept a babysitter, spending a lot on this babysitter, but the babysitter is not doing his work properly. What to do? But as a result, the child's experience of his childhood is very traumatic. Or a young child is abused physically, emotionally, socially. So this happens. Or he is separated from his parents at an early stage. So then what happens when he is growing up? He is not able to develop proper eye contact with the other person. Or he is trying to be happy, trying to show that he is comfortable, he is fun loving, but he is actually not. He is faking it out. Or he is over clingy. So such children, even in their personal relationships with peers also, they tend to be over possessive, which again spells disharmony in relationships, even with their peers. They also develop lack of ability to give and receive affection. They are not able to give or receive affection properly because they don't know the rules. They have not seen it done in a proper predictive manner at home. And this leads to being inappropriate, demanding and clingy in relationships even as they grow up. So what they do, try to hide these particular symptoms by asking nonsense questions in the class. He is the attention seeking learners for you. So please be careful, be attentive for such a child in the class, and continuous chatter in the classroom. His relationship with his peers is very poor. He has low self-esteem and he is the basic bully or the attention seeker in the class for whatever reasons. But now learners, dear teachers to be now, you need to know, we need to realize that these are the children who need our attention, our care, our affection more than other children. Because they are going through such issues. They have difficulty in learning from their mistakes. They do develop learning problems, developmental delays, some sort of learning disabilities, poor impulse control. When they are angry, they are angry. They just cannot control their anger and they will hit out at other children whenever they feel like, if they get angry. So poor impulse control is there. And abnormal speech patterns may also be developed, and maybe it may lead to abnormal eating patterns like binge eating or anorexia nervosa, could be anything, bulimia, could be anything. Or just to show that they have power, they are comfortable with their own selves, they will try to be destructive to self, others and property. They want to hit at their parents, they will cut themselves, cut their wrist, or they will just do something stupid on their body just to hurt the parents or the primary caregiver. Or they will hit others, they will break property, or they will be very cruel to animals to show that they don't care. Or they may even resort to stealing. I don't like you, so I have taken your pen. Okay, cool, chill. I don't like you, so I just stole something, picked something. Stealing is not that they are stealing. For them it is they are picking because they don't like something or somebody. As simple as that. And in such cases, people with children with attachment disorders, the frequency of such behavior becomes such that it cannot be ignored. And parents also are not able to control them, to understand them, and there is unsatisfactory connection with the parents. This is very important, the unsatisfactory connection. And of course the anger problems, plenty of anger problems, which may result in temper tantrums or acting out or being passive aggressive or being manipulative, and they are not able to control their angers in a socially acceptable manner. So that is one basic issue which they face. Not able to show genuine care and affection. So learners, it is very important for us to understand what this AD child, attention disorder child, is going through. And it is not that he is doing it deliberately. He cannot help it. He cannot accept and understand affection because he has not seen it. And when somebody shows it, he feels suspicious. And that is why his conscience becomes underdeveloped. Now, children with reactive attachment disorder may act like they don't have a conscience and fail to show guilt, regret or remorse after behaving badly. It's very important. They don't understand it, and sometimes teachers may scold them, may shout at them, may hit them, but they are not remorseful. They don't feel regret, and teachers feel, aren't you feeling ashamed? Now this is something which we as learners should not do with such children. They already are feeling alienated. Why should we add to their alienation? So here is something, learners, it's a very important tip in managing such children, whether as parent or even as teachers. So have realistic expectations. Helping your child with an attachment disorder may be a long road. It's difficult, yes, but not impossible. So focus on making small steps forward and celebrate every sign of success. So expect from them what your child can do. Don't go beyond being realistic. It is very important. Patience is essential as teachers and as parents. The process may not be as rapid as you like. In class also we want everybody to be at the same pace to understand what we are teaching them, what we are expecting the kind of assignments from them, but they may not be able to bring that kind of quality work. So we need to develop patience. By remaining patient and focusing on small improvements, you create an atmosphere of safety for the child. Child should feel safe and secure. Foster a sense of humor and joy. Joy and humor go a long way towards repairing attachment problems and energizing you even in the midst of hard work. So joy adds spice to life. Humor adds spice to life. Remember that. All of us can do with a good laugh, even a small child. Okay, and as parents, as teachers, understand your stress levels. Manage your stress, which is very important. If we are taking care of ourselves as parents, as teachers, we will be able to give attention to our child also, who needs actually more attention. So rest, good nutrition and parenting breaks, even for teachers, help us relax and recharge our batteries so that we are able to give more attention to the child. Stay positive and hopeful. Now positivity and optimism, they add in helping us become resilient. So it is very important. We should never discourage them, because if we are discouraging, we are being non-positive, and they will look for others. They will turn to others for reassurance, and maybe the world is out there to exploit them. So we need to be positive and hopeful all the time. Positive and optimistic. So this is very important. Remember. Another thing is we need to set limits and boundaries. It is important that they understand what behavior is expected of them and what is not acceptable, and what the consequences will be if they disregard the rules. They must realize that as teachers, as parents, we have patience. We are not expecting something which is beyond their capacities. We are having realistic expectations from them, but at the same time there are limits and boundaries to what we will expect from them. They can't trample these boundaries. So it's very important for them to understand that, and for that parents and teachers have to have lots of patience, but it can be done. This is something which we need to remember. And another thing we need to do is take charge, but remain calm when the child is upset or misbehaving. So whatever the situation may be, it may be very provoking, but we need to realize that we need to stay calm so that the child also understands, respects, accepts our calmness and learns this kind of behavior. He is also going to imbibe this calmness from us if he sees us remaining calm, polite, serene, tranquil, not behaving in a very hyper manner. So we are giving good role models for the child to inculcate, to imbibe. Child will also learn good behavior, what we want from him. But remember, never discipline a child with an attachment disorder when you are You as parent, you as teacher are in an emotionally charged state. You have to tell him that yes, if he does not do this or if he does like this, there are pre-established consequences. But it should be stated in a cool, matter-of-fact manner. It is very, very important. So please realize that as learners, and we can go a long way with our child. As I keep reiterating myself, it is tough, it is difficult to handle a child with an attention, such kind of attentional disorder. But it doesn't mean that we can't help him out or it is impossible. It may be tough, it is not impossible. Another way is be immediately available to reconnect following a conflict. This is very important, learners, that after a conflict or tantrum where you have had to discipline your child, it's very important. Be ready to reconnect as soon as he or she is ready. Why? Because this reinforces your consistency and love and will help your child develop a trust that you are there with him through thick and thin. You may be angry with him. Let him understand that you were angry, you were upset that this particular behavior you were not comfortable with from him. But that doesn't mean that you will not be there for him. You are willing to reconnect as soon as the child accepts or realizes his mistake. But it has to be shown in a very positive manner. His mistakes also have to be pointed out in a very positive manner. And then only he'll understand and he'll be able to own up his mistakes, and then he will initiate repair also. Remember, when you let frustration or anger get the best of you, or you do something you realize is insensitive, quickly address the mistake. So even when we get angry, we get upset and we shout at the child, we also own up our mistakes, because that will help initiate repair. The child will understand that although the parent was angry or upset, still he is with me. I am still loved. And he is also learning that yes, there is no harm in saying sorry or accepting mistakes. So we are being their role models, and we need to give a positive role models to the child. And last and most importantly, we have to maintain predictable routines and schedules. A child with an attachment disorder won't instinctively rely on loved ones and may feel threatened by transition and inconsistency. Remember that for us, it may be just an adventure, like when traveling or during school vacations. A familiar routine or schedule can provide comfort during times of change. So this is also a very important thing we need to understand. We may feel that something different is happening, so it's an adventure. So we are going on vacation, we are going somewhere else he is unfamiliar with. But even this unfamiliar path can be tread with a familiar consistency, that okay, this is what will happen, we are now going to pack the bags, we are going to go there, we are going to stay for some time. So parents are there to explain to the child. The child may feel threatened, or there is a change of school or change of teacher in the school. The child may feel threatened. Okay, English was taught to me by so and so teacher, now the new teacher will come and she is going to shout at me. So let me also do something which will make her feel more attentive towards me, and she will give attention to me also. So he will do something, those attention seeking behaviors which the teachers may not like and which are not good. So all of us as parents and teachers, learners, we need to be very, very careful about using these strategies with our children those who are going through attention disorder. Attachment disorder is basically they are not able to develop proper attachment, which leads to attention disorder also. So thank you so much for being patient listeners, and I hope that you will be able to use these tips in your classroom as well. Thank you so much.